Dr. Yoni Whitten here. If you've got an unsightly hump at the base of your neck or in your upper back, you're going to want to pay close attention to this video because the first step to getting rid of that problem once and for all is understanding what's causing it. And that's what we're going over today. Let's get into this. There's a ton of information floating around out there on the internet on the subject of neck hump. Some of the videos that have been put out on this topic have received millions of views. Unfortunately, some of those videos are putting out misinformation on the subject. They use terms like Buffalo Hump and Dowager's Hump in the same sentence as neck hump, and by doing this, they blur the lines between three separate and distinct conditions. And in the process, they confuse a lot of people. What I want to do today is clear up the confusion and explain exactly what neck hump is and what it's not. Now, contrary to internet lore, when you see an image like this one where a person's laid down a fat pad or a buffalo hump at the base of their neck, this is not a postural problem. I scoured the scientific literature looking for any references that talk about the body laying down fat to quote unquote protect the spine in cases of forward head position or hyperkyphosis. That's where you have the spine protruding at the base of the neck or the upper back. And I couldn't find one single study that talked about that happening. I've also not found that to be the case in over 15 years of clinical practice. So what is this? I mean, obviously there's a distinct fat pad like that, and we have a lot of people walking around with this. When you see fat laid down in this type of pattern, you should be thinking a hormonal imbalance. And that hormonal imbalance almost always stems from something called Cushing Syndrome. Now, Cushing Syndrome is a situation where your body has too much of the hormone cortisol circulating. And what you get is a distinct pattern of symptoms, beginning with weight gain that usually comes on rapidly. You get the body laying down fat in very specific places. Here, underneath the jaw, that gives the impression of an elongated or moon face. You get the base of the neck, the buffalo hump that we were just talking about, and then you get a lot of fat being laid down around the midsection of the body, giving that classic apple shape appearance where the center of the body is very large in comparison to very slim arms and legs. Because of the rapid weight gain, these people get what are called pink and purple striae. These are brightly colored stretch marks that you usually find around the chest, the abdomen, the arms, thighs, and buttocks. These people can get abnormal hair growth, they have fragile skin that bruises easily, they can have reddening of the cheeks and acne, and if they get injured, they tend to heal very slowly. This is important to note because if you're going to treat a problem, you need to know what's causing that problem. So here you have a patient before a course of glucocorticoid treatments, and here's after. Notice the formation of the buffalo hump indicated by the white arrow, and then the blurring of the jawline and the elongation of the face because of the fat deposition underneath the chin. Again, important to note because you don't want to spend a bunch of time doing postural exercises with somebody who obviously has a hormonal problem. In fact, you can see in this image on the right that the whole of his ear is lined up very closely to the center point of his shoulder. And we have x-rays of people with severe Cushing syndrome. Here you see in gray in the back of the neck, that's the classic buffalo hump at the fat deposition there. And you can also see that the curvature of the neck is actually maintained beautifully in this person despite having Cushing syndrome. So what you want to do instead of wasting a bunch of time on postural exercises, if you have fat deposition in those specific places and any of those other symptoms that we just talked about, is get in to see your doctor. Really simply, they're going to review any medications that you're taking, creams, pills, injections, inhalers are a common cause. Another thing that people can see with Cushing syndrome is HIV treatments that often lead to this pattern of fat deposition. So get in to see your doctor, have them review the medications that you're taking, and they can do some simple blood and saliva tests to see what your cortisol levels are, and you can treat it that way rather than wasting a bunch of time on postural exercises that have no effect whatsoever on a hormonal problem. So now that we know where a buffalo hump comes from, we're going to talk about a completely different kind of hump known as a Dowager's hump. A Dowager's hump is an excessive forward bending of the middle part of the spine, otherwise known as a hyperkyphosis. You can see in the image here that the body takes on a very distinct shape, almost like a humpback, and it looks nothing like a buffalo hump. You'll also notice that despite the fact that the spine is protruding so severely, there is no fat pad laid down at the base of the neck or the upper back. Now, a Dowager's hump typically occurs in people with low bone density or osteoporosis, where the spine literally loses the density to support itself. It fractures, and the vertebrae go from this nice square shape to collapsing in on themselves and forming a wedge shape, which lends that sharp curvature to the back. Now, because this is a bone density issue, usually it's most commonly seen among the elderly population, and more often in women than in men. The people will very likely complain of a sudden onset of extremely severe pain in their back, and that's the moment when the vertebrae collapse and fall in on themselves. They're going to have that marked curvature, that distinct shape in the middle part of the back. They will have lost height, a significant amount of height very often, and the abdomen will protrude because as they lose height, the organs have to be pushed forward because there's not as much room to accommodate them. And then of course they're going to have extreme tenderness along the spine, both due to the fractures and the fact that the paraspinal muscles have to work so much harder to hold these people up because they've lost some of their normal support structure. So here you have a thoracic spine x-ray where the vertebral bodies are intact. You can see the square shape. They're outlined in very bright white and the black discs in between there. And then here you have a Dowager's hump, and you can see in the middle part of the back that wedge-shaped vertebrae that's fractured and actually collapsed in on itself to give that sharp humpback appearance known as a Dowager's hump. So definitive diagnosis of a Dowager's hump is only made with an x-ray that looks like that, showing the wedge-shaped vertebrae. However, if you want to get a simple test to watch out for it, we just do a standing toe touch. You can see here the image that's all in gray. The person bends down to touch their toes, and it's a nice, smooth, even curvature from the base of the neck down to the tailbone because those vertebral bodies are evenly distributing the bend across the entire spine, whereas if you take somebody with a hyperkyphosis and you have them do this, the wedge-shaped vertebrae is going to create a very distinct sharp curvature in the middle part of the back, and this is what a standing toe touch looks like in a person with that type of vertebral collapse. You see that sharp, almost camel hump there. So that is a Dowager's hump. And then the final condition that I want to talk about, the condition that I believe these videos are referring to when they say neck hump, is actually a forward head position. Now, forward head position, really simple, is a loss, reduction, or reversal of the normal lordotic curvature in the neck. So if you look at the image on the far left here, you'll see that the shape is actually very similar to the shape of the curve in your lower back, the lumbar curve that everybody's so familiar with. The apex of the curve points in the direction that you're facing. But when you lose that curve, it straightens out, and in severe cases, it actually pushes in the opposite direction, which forces the head out in front of the body. Now, forward head position goes by a lot of other names. It's also known as an anterior head carriage. Tech's neck, tech neck have become popular in recent years. Older names for it include reading neck and scholar's neck, and now we have to add neck hump to the list. But it all stems from the same thing, which is a loss of the normal curvature in the neck. Now, this is one of the most common postural problems that we see in modern society. There have been 6 studies on it dating back to 1992. And most of those studies, 5 out of 6, came from 2016 to 2019. And the average incidence that we're seeing of forward head position in modern society is just under 70%. So we've got 2/3 of the population walking around with this problem, and it leads to all kinds of symptoms. Now, according to Kapanji, the problem with forward head position is that for every inch that your head moves forward, it gains 10 pounds of weight, meaning that your muscles have to work that much harder to hold you up in that inefficient position. This idea is supported by Dr. Rene Callier, who said that a head in forward posture can add up to 30 pounds of abnormal leverage to your neck. And this is enough to pull your entire spine out of alignment. So you figure that the head in a neutral position weighs 10 to 12 pounds. Push 3 inches forward, you've added 30 pounds to it. It now weighs 42 pounds. That's how much weight the muscles at the base of your neck and all along the back of your spine are having to resist for all hours of the day that you're standing up. Now, here you see an x-ray of a person with a normal neck curve. And again, you see that nice lordosis. The arc of the curve is pointing in the same direction that the person is facing. And here you see a person with forward head position where the neck curve is actually reversed and pointing in the wrong direction. Now, this is the definitive way to make a diagnosis of forward head position, but there are lots and lots of clinical signs, and if you know what to look for, it's not that hard to find a forward head position. First and foremost, what you're going to see when looking for a forward head position in a clinical setting is that when looking at the posture from the side, the head will be pushed out in front of the body. Now, to look for this, just get your friend to take your phone away from you so that you stop encouraging a forward head position and snap a photo of you from the side. What you should see is that the whole of your ear should line up directly over the center point of your shoulder. But with a forward head position, what you're going to see instead is that the whole of the ear will be pushed out way in front of the shoulder. Now, that's a super strong indicator for forward head position, but in and of itself, it's not enough. The other thing that you need to see is alterations in functionality. And in this case, that means the ability to move the neck. See, what happens is as you pull that normal curvature out of the neck, you pull the joints of the spine out of their normal alignment, and joints that are not in normal alignment don't function properly. So proper function in the neck in terms of rotation means that you can go 85 to 90 degrees, smooth, easy, and pain-free rotation in both directions. With side bending, it's 40 to 45 degrees, smooth, easy, and pain-free. But for people with forward head position, they will not be able to do the full range of motion, and it will hurt when they try to do it. What types of pain are we talking about? Well, with forward head position, the most common types of pain are neck, shoulder, and back pain. This pain follows a very specific pattern in that it's better in the morning after they've spent the entire night resting, not being affected by gravity, and worse at the end of the day, as gravity has been acting on all of that extra load with the head pushed out in front of the body. Accordingly, it's made worse by being in flexion-based activities. If you spend hours and hours working on your computer, you're going to hurt more and your range of motion will be less, and it will be relieved when you lie down on your back and you're fully supported and your muscles don't have to work to hold up all that extra weight. These people often suffer from TMJ and all different kinds of headaches. The muscles at the base of the neck will be tender to the touch. If you go to give these people a massage, it's going to hurt like crazy, and their neck is often thicker than a normal person, or in some cases thicker than it used to be. The other thing that the journal World Neurosurgery gave us in 2010 is something called cervical kyphosis trapezius sign, or what I call TRAP sign. This is when you take a person who's never lifted weights in their life, and yet they have these heavily developed trapezius muscles here at the base of their neck, like a bodybuilder would have. And the reason that they have these is because essentially those muscles have been bodybuilding and building themselves up to hold the head way out in front of the body in that inefficient position. But because they never get a break, they are tense, they hurt like crazy, and they stand out like you see in this image where the muscle's actually popping out of the skin. And the journal World Neurosurgery found that trapezius sign was enough in and of itself to diagnose a reversal of the normal neck curve. So watching out for those heavily developed, tight and tender, painful muscles at the base of the neck is a great way to watch out for a forward head position.
So there you have it. For the vast majority of people that are walking around nowadays with a bump at the base of their neck or in their upper back, the number one cause is a loss, reduction, or reversal of the normal curve in the neck, which forces the head out in front of the body, making it way heavier and causing your body to push the upper back outward to counterbalance the increase in weight. Now, over the next few weeks, I'm going to be releasing videos with specific strategies for how to put the normal curve back into your neck, get rid of that unsightly hump in your upper back, and move better than you ever have. Make sure to like this video, comment down below, and subscribe to the channel so that you get updated when those videos are released. Beyond that, if you're looking for a specific strategy from A to Z for how to overcome neck hump and forward head position, be sure to check out the Pain Fix Protocol. That's my program that will guide you through every step of the process. I'm going to include a link in the description down below. That's all for now. See you next week.